Hi, this is Neil from Growlies, and I'm here with Daniel Orrego from Keto Pet and Pause for Change. Now, you're also involved with is it epigenetics? What's it called?
Yes, Epigenics Foundation. Epigenics
Epigenics
Foundation,
Foundation. Thank you
indeed.
very much.
Yes.
Now, you have been involved in a lot of things to do with health around cancer and diet. And that's why your work intrigues me so much. And so, tell me a little bit about you and how you even got into that, Daniel.
Sure. So my trajectory towards this space was really a little bit oblique. And what I mean by that is, while I did study the sciences in college, I ended up taking sort of a hard diversion from that and going into tech and spend a lot of time as a network engineer in the niche industry, which was the travel technology industry. And I really only had occasion to come back into this, to the research field by virtue of connecting with Ron Penna, who's the CEO of Quest Nutrition. And him and I spent many, many years together looking at the intersection of metabolism disease, specifically how nutritional protocols impact both disease acquisition and disease management. So that was kind of the genesis of that. And of course, that work has continued since that time.
Awesome. And then, the epigenetics was the first thing you did, and then you got into Keto Pet. Is that correct?
Indeed. Well, it was almost concurrently, and really Keto Pet was about trying to validate what we understood anecdotally in human trials,
Mm-hmm.
right? In other words, what we could know about case studies and small cohort trials regarding mainly brain cancer and breast cancer, and how uh, uh, nutritional ketosis could impact those disease profiles. And what we also understood in rat studies, where the use of exogenous ketones or calorie restricted or carbohydrate restricted diets impacted the mice in those studies, and their ability to either delay disease acquisition or lengthen survival times. And the reason why we wanted to work with dogs was really twofold. One was because we love dogs, so it wasn't difficult to go down that path. The other is because, as far as a model goes, dogs are a much better approximation of a human than a mouse is. And so we could see disease appear in ways that were much, much, much closer to tumor models that you would observe in humans. Oftentimes, the tumor models that you observe in rats are induced, or they're a result of genetic aberration imposed on the mice, which doesn't really reflect how disease is acquired in humans. So that was really the start of it. And Epigenics Foundation was really the nonprofit that we wrapped around Keto Pet, because what we realized was that the results we were getting from working with dogs not only translated to humans, but really translated uh, across scientific modalities and across species. And so we needed sort of a larger umbrella to capture everything that we were doing, particularly because we took an interest in looking at novel disease markers as a way to assess cancer effectively at stage 0. Which there's not a lot of people playing in that field. And it was something that really piqued our interest, because cancer is such a difficult disease to manage once you get past stage 1.
Mm-hmm.
And so our thought was, hey, look, if we can play the game of detecting cancer prior to the formation of a solid tumor, now we've increased our opportunity to manage the disease effectively. So that was really and truly what Epigenics Foundation was all about, and continues to be about to this day.
Awesome. Okay, and so you said an awful lot there. So I just need to unpack a little bit for our people.
Sure.
So some of the terms, and some of the history they may not understand. And so,
Sure.
I guess, let's talk about history. And so,
Yeah.
real briefly, if we talk about humans and dogs, and we go back
Yeah.
to pre-agricultural era, so let's say
Sure.
between 7 and 10,000 years, which in the lifetime
Yeah.
of our genome is not actually that long, because we can track the human genome back
Okay.
1.5 million years before, we're something resembling the modern human, and then
Right.
and the dog, we can track it back to the wolf about 40,000 years ago or so, something like that, and so during those times we would be. And it's theorized that we would probably have been in ketosis most of our lives. Do you agree with that?
Yeah, I mean, well, I think that's something that, observationally and deductively, it's not a hard place to land at that conclusion. And here's why. Food insecurity, food scarcity, or outright lack of food was a common occurrence in both the human and canine experience.
Absolutely.
I don't think it's controversial to accept that.
We
So
say
if
in the story that they're animals of feast and famine.
Right, precisely. So going through intervals of ketosis was a normal metabolic transition. And in fact, when you look, it's so interesting because now, and in fact, some of the best work on this is being done at the Applied Science and Performance Institute in Tampa, Florida. Dr. Lowry and his colleague, Dr. Jacob, are doing great work at looking at the performance effects of being in ketosis, both cognitively and physically. There's actually some physical performance effects that go along with that. And for anyone who hasn't eaten just for a while, let alone staved off consumption of energy for a period of time sufficient to induce ketosis, notices an upregulation in energy, notices an upregulation in mental acuity. So as an adaptive response to lack of energy, being in nutritional ketosis was something that actually aided survival for both dogs and humans, right? If your brain gets a little sharper when you don't eat, that might improve your chances of actually acquiring food.
Mm-hmm.
So I think this is something that, for anthropologists and evolutionary biologists, none of these topics are particularly controversial. I think, in fact, what is controversial, because it's only in the most recent epoch of human history, maybe the last 80, 90 years or so, that it's even possible for a portion of the population, mainly in Western countries, to never be in ketosis.
Right.
That is controversial from an evolutionary standpoint, right? In other words, that would constitute an evolutionary aberration in the modern epoch. In other words, the ability to sort of Netflix and chill and eat the Hot Pocket and the frozen pizza throughout the day is a modern phenomenon. That was never a circumstance that humans could indulge in with any regularity, even in the very, very recent past. And of course, in areas of the world where there's tremendous poverty, food insecurity and food scarcity persist, and hence the interval of going in and out of ketosis is still part of those populations' experience.
So you went with intermittent fasting is what you're kind of hinting at there. And do we see benefits from the short-term ketosis of intermittent fasting in animals in studies?
To a degree, and one has to be really careful about this, and probably the guy having the best conversation on this specific topic is Dr. Peter Attia, who has not only done a lot at looking at this, but has done an excellent job of sort of collating and distilling the research and teasing out where we can have a high level of confidence and saying, yes, there is a benefit. But the studies that have yet to be done in this domain consist around the comparative analysis of windows of time where one is not consuming. What's the benefit of 8 hours, and what is the criteria for measuring that? And how do you compare that against 16, 18, right, 24, 36, et cetera, et cetera? No one's put a fine point on that yet, so it's hard to say. What we know a lot about are what the metabolic responses are. But to a degree, we know what the performance benefits are. For example, and this isn't new work, it's a little bit older work, maybe 10, 15 years old now. Dr. Jeff Volek has done an...
Oh, no.
you know, 50 or 100 miles.
So bear with me, Daniel. Sorry.
Oh yeah.
We just lost you there for a sec, and so as soon as you said the doctor's name, it's all good. It's the life. Welcome to the modern internet, and cell phones. Ultimately, you know, it's funny. The thing that the phone does the worst is actually be a phone. But
right.
so you were just saying, and I don't mean to disrupt your train of thought. You mentioned the doctor's name, and then we lost you completely. Could you just reiterate?
Yeah. So,
I apologize.
Yeah, I'll repeat. No problem. So Dr. Jeff Volek he's done the best work at looking at the performance effects of ketosis on ultra marathoners. These are the gals and guys that run 50, 100 miles. And what he found is that being in ketosis totally changed their training interval insofar that there was less injury, there was less inflammation, there was a greater ability to extend the training window in preparation for events. What's also curious, though, is to look at what the nutritional protocols were during the event. These guys were certainly not in ketosis. Why? Because they had a tacit understanding that burning sugar during a performance interval is a huge performance benefit or performance enhancement. So there's where things start to get really interesting, which is, you know, the conversation gets more nuanced because it's easy to say sugar's bad. Or carbohydrates bad, but is it? Is it?
It depends on when. Yeah.
Right. It's what are you doing with it, and how are you doing it? Right. Probably the best example or best sort of mental model for this is you take two horses, one in the pasture, one in the wild. They're both eating the same grass. Grass has a tremendous amount of sugar in it. The horse in the pasture goes to founder. The horse in the wild doesn't. Why? Well, one simple way of looking at that is that the horse in the wild is constantly facing predator threat, which means they're constantly moving as they're eating. The horse in the pasture faces no predator threat. They just stand there all day eating. So there's a huge difference in metabolic turnover, even though both horses are ostensibly eating more or less the same things.
Right.
So I think there's an energy consumption, nutrient partitioning, energy turnover coefficient there that one has to look at when assessing the value of high glycemic carbohydrate as part of a nutritional program, particularly when performance is involved. So these topics do tend to get somewhat layered, if you will.
Yeah, and they're complex. And so you hinted at one of the real true benefits of a ketogenic approach to diet, which is inflammation. And it's considered an anti-inflammatory diet, and most of our modern diseases are related to inflammation.
Yeah, and that's probably where we have the strongest body of data, you know, both in rat and human models, you know, looking at inflammatory markers like interleukin-6, high sensitivity C-reactive protein, homocysteine. You know, you start looking at these body of inflammatory markers and you start to realize that if you plot a curve from, you know, a high glycemic nutritional program and you start to transition to a lower carbohydrate, calorie controlled, and perhaps even ketogenic diet, you see just the bottom drop out of those markers. I mean, that is something that has been so consistently measured, both formally and, you know, anecdotally. I look at those types of blood panels in myself all the time in both directions. I look at how can I make these markers go up? What are the things that can do that? And then how can I subsequently make them go down? And you can pretty much tune your response to food inputs along those lines, which is actually an interesting way of looking at nutrition, because a lot of times you know, the classic question is, well, what should I eat? What should I eat? Should I eat a Mediterranean diet? Should I eat a paleo diet? What should I eat? And what I like to do is invert the model. And what I mean by that is first ask, what is the metabolic outcome that I wish to achieve? In other words, do I want to make my insulin go up? Do I want to make my insulin go down? Do I want to induce inflammation? There may be very legitimate reasons to do that, particularly to stimulate adaptive response. Or do I want to keep my insulin steady? Once you've determined that, then you select the distribution of macronutrients and total caloric density pursuant to that metabolic outcome.
Hmm.
And finally, yeah, you can select foods, but the window of foods that you would select dramatically decreases as a result of answering those first two questions.
Right. So have a
And so
goal.
that's you're right. Yeah, have a goal. What's the outcome? What are you trying to get to? Then finally, yes, pick foods that comport with that pursuit. Right.
Right. Right. And then, a lot of people nowadays, we see an abundance or really it's a terrible tragedy of diabetes in our communities in both dogs and
Hmm.
humans. And so they know
Yes.
of keto as ketoacidosis, a diabetic ketoacidosis. And can you explain the difference between a ketogenic diet and diabetic ketoacidosis, which is your life at risk?
Yes. Indeed, and the great news is it's very simple to understand what the differences are by just measuring glucose and ketones. So with diabetic ketoacidosis, which is incredibly serious, if that's happening, bad things are ostensibly transpiring. One can understand that by seeing a high glucose number and a high ketone number. What would that look like? Well, it'd be glucose, higher than 150, and ketones like 6 to 11 millimolar, right? So that's ketoacidosis. Ketosis is an entirely different metabolic profile. You would see, blood sugars of 82 milligrams per deciliter, and ketones of 0.9.
Wow.
1.2 millimolar. You see what I mean? So it not only is it not the same thing, measurably you're looking at a totally different scale and relationship between serum glucose and ketone levels between the two. And so that's oftentimes, because they sound similar, ketosis and ketoacidosis, oftentimes are conflated as the same
Exactly.
thing.
Yeah.
But yeah, measurably they couldn't be more disparate, really and truly.
Yeah. And then
Yeah.
I know for a fact that somebody who goes to my store is going to watch this video and they're going to say, I really, really wish I could do keto with my dog, but he's had pancreatitis in the
Yeah.
past. Is it possible? And how would you approach a ketogenic diet for a dog who's had pancreatitis and the owner believes that dog's never supposed to eat fat again? Because
Sure.
that's what the
So
vets have told them, right? We see that in the store all the time.
right. And, first of all, pancreatitis in canines is incredibly serious. So to take it seriously in your approach to addressing nutrition is the correct point of departure. The first step would be to take a measure. I believe it's a PLI test that you can take that will determine with specificity if the dog currently has pancreatitis, even low grade. So that's very, very important. Once you have a measure, whatever that measure says, the first step that can be taken, which is a very simple one, is to begin to decrement carbohydrate from the whatever the nutritional program is. And sometimes that's easier said than done. And what I mean by that is the easy part is to understand what it takes to lower carbohydrate. For example, if a dog's receiving, like, say, a kibble of some sort, like a Royal Canin or an Old Roy, just feeding less accomplishes that. So that's the easy part. The hard part is people feeding their dog less. Oftentimes, pet parents are reticent to do that. So that's the easy part. The requirement to get a dog into nutritional ketosis can be achieved actually without a ketogenic diet. And what I mean by that is either controlling calories sufficiently on a daily basis, or controlling calories through interval. In other words, feeding on one day, not feeding on another, can do two things. One is begin to ameliorate any acute pancreatitis symptoms. It can have that effect, definitely. And it can slowly bring the dog's metabolism closer to a state of ketosis, even if they're not quite producing a high amount of ketones. And then what's also phenomenal about dogs is their metabolism is so fast anyways, even dogs who have endured some nutritional abuse over time. And so even without dramatically increasing fats and lowering protein and carb, dogs will oftentimes go into nutritional ketosis just by controlling calories and carbohydrates sufficiently. And that there's a spectrum for that. Every dog is different, but what the great news is just even very subtle changes in nutrition can have profound effects that are very favorable for the doggy.
Let's talk about fat, because fat is a key part of the calories in a true ketogenic diet. And it's through fat that they get the majority of their calories in a ketogenic diet. And so what are the fats you would want to see in a dog's ketogenic diet? And like, are we talking, let's talk about an average medium-sized, let's say 50-pound animal. Are we talking like a quarter pound of butter a day? Are we talking about, how much? Are we talking about coconut oil? Are we talking about olive oil? Like, what are we talking about? And how much on an average 50-pound dog would I have to use?
Sure. So this is actually, you're bringing up a phenomenal topic, because one of the things that is, maybe it's not counterintuitive, but maybe there's just less emphasis or focus on it, is that for a dog, or for that matter, even a human, the requirement to add fat to induce nutritional ketosis is almost zero. Oh. And what I mean by that is if you look at this is something that like sometimes people forget. And in fact, with dogs, it's almost reflexive that you don't have to do that. And what I mean by that is if you look at the ketogenic ratios that are talked about in clinical practice. What I mean by that is talked about for addressing refractory epilepsy and pediatric medicine. They talk about the 4-to-1, the 3-to-1, the 2-to-1, the 1-to-1, etc. Right? So what does a 4-to-1 ketogenic ratio actually represent? Well, what it's saying is for every 4 grams of fat delivered, correspondingly 1 gram of protein plus carbohydrate is delivered. So that boils down to about 90% of caloric density coming from fat. So that's a 4-to-1 ratio. A 3-to-1 ratio is 87% of calories coming from fat. A 2-to-1 ratio is 82% of calories coming from fat. A 1-to-1 ratio is 69% of calories coming from fat. So the reality is a 2-to-1, 3-to-1, 4-to-1 is ostensibly the same thing. You get a pretty big fat calories break at the 1-to-1, but even that you don't really need for either a dog or a human to go into ketosis. You can do a 0.5-to-1 ketogenic ratio, which is about 53% of calories coming from fat. And provided that you control overall calories sufficiently, both the dog and the human can go right into nutritional ketosis. And that makes things incredibly easy when it comes to feeding a dog. Why? Because if you go to the store and you buy a 90-10 ground beef, guess what? That's right around a 0.5-to-1 ketogenic ratio. So the requirement to add more butter or add MCT oil or add ghee is simply not there. The only time that conversation becomes really relevant and important, and in fact should be focused on, is if one is attempting to use a nutritional intervention like a ketogenic diet to triage disease. Then all of a sudden then now you're having a very serious conversation about 4-to-1 and 3-to-1 for acute periods of time. But as far as like feeding a ketogenic diet every day, just buying 80-20 beef, you're right around between a 1-to-1 and a 2-to-1 ketogenic ratio, depending on how much fat.
So most of the veggie-free mixes I have are generally right around there, and those would be ketogenic diets essentially for a dog.
That's exactly right. And the great news is, no one has to take any of this on faith. You can just simply feed those foods and measure glucose and ketones, and you'll see, in dogs, what you really see is glucose tends to go down pretty dramatically. Dogs can run around in the low 60s and have all the energy in the world. Oftentimes you don't see super high ketones, and that's likely a result of high utilization. In other words, the dog may be in ketosis, but they're not expressing high ketones because what you're measuring in the pipe, so to speak, in other words, in blood draws, ketone bodies are low because they're being utilized in tissue. So you don't see free ketones present in a blood measurement, but that doesn't mean they're not in ketosis, particularly when you observe the blood sugars can be so low, and yet the dog has all the energy in the world.
So let's say I have a breed that's prone to cancer, and there's
Mhm.
many of them. Your Goldens,
Sure.
your
Oh yeah.
Bullies, there are a whole bunch of breeds now that are prone to cancer. And just to clarify for listeners, dogs get
Mhm.
cancer more than every other mammal on the planet, and so they're a great example of what we're doing wrong with diet. And if I have a dog who's 50 pounds and he's eating 450
Mhm.
grams of food a day, and I'm just trying to be proactive in regards to giving him a diet that has some anti-inflammatory properties, and so I choose a
Yeah.
ketogenic approach. What I'm hearing is just basically using a low carb, low sweetener, so no carrots and no root
Yeah.
vegetables, primarily greens, things of that nature, as their diet, and maybe supplementing with some oils or stuff like that. I'm doing what I need to do.
Yeah, and what you're really describing is an approximation, probably the closest approximation you can get to what a dog might experience in the wild, right? I mean, they're facultative carnivores, so they'll kill something, but they'll also, eat something that's already been killed.
Mm-hmm.
And so, there's not a lot of there's no cooked food unless you consider, you know, natural fermentation of a meat source in the sun to be cooked, so to speak. But they'll eat, a rotten carcass. They'll eat something fresh that they kill. The amount of carbohydrate that they would consume on an annual period would, it would be less than 10% of the
That'd be
overall
magnificent. Yeah.
consumption food, and it would probably be a carbohydrate source that's highly fibrous.
Mm-hmm.
If they're eating the viscera of, say, a rabbit, right? Yeah, they might get some partially digested fibers, but nothing like a high glycemic rendered kibble. It's
Right.
just, it's not even a comparison at that point. Yeah. So, I mean, and maybe that's the way to think about these things, is to consider, hey, what's the closest approximation that I can get to within a certain level of convenience and economic consideration to what a dog might experience in the wild. But right there, that eliminates all bag and canned foods. It just that goes out,
Yeah.
and you're left with any number of fresh food choices at that point.
I totally on board with you. And then, so in that scenario, I got the dog, I'm trying to practice an anti-inflammatory diet, I'm doing all the things I think of as right. Where do exogenous or, dietary ketones come into play, or do they at all?
Well, I mean, these are elective choices, right? And one of the things to keep in mind is that, in fact, maybe with very few exceptions, what's being sold as exogenous ketones doesn't quite meet that standard. And these are picky considerations, but they're interesting, so we can talk about them. And what I mean by that is beta hydroxybutyrate is actually not a ketone; it's a carboxylic acid, and must be converted in the body to a ketone. And those conversions happen in different ways depending on which isomers you're using. And there's some good science around determining which ones are most bioidentical or most convertible into acetone and acetoacetate. But the best work on this has been done by Dr. Angela Poff and Dom D'Agostino and Dr. Kessel and the whole crew there in Tampa. And what they've seen is that in a disease model, the introduction of exogenous ketones, even BHB ketones, can have an impact both in vitro and in vivo on cancer cell lines. Now, is it chemotactic? No. And what I mean by that is, does it behave in a way that kills cancer? No, it doesn't. But what it can do is act as a competitive inhibitor to tumor metabolism. And so if you look at those papers, you can kind of see like, yeah, there's something there. As a lifestyle supplement, exogenous ketones may have a role to play when it comes to cognitive performance. And it may have a role to play when it comes to controlling certain metabolic effects. But as a supplement that might make sense to give every day, it's tough to have a high level of confidence that we know that should be the case. And the reason I say that is because with most of your BHB products, they're delivered bound to a mineral: magnesium, potassium, calcium, salt, etc. Well, to get a clinically significant dosage, the amount of salt that one would have to take in to get that payload of BHB is enormous.
Right.
And the lab synthesized versions, the 1,3-butanediol, the ketone diester, yes, one can acquire those. The ketone diester is probably the best one, because it's a combination of the native acetone and acetoacetate. A, they're extremely expensive, and B, they all taste like jet fuel. So the practical side of truly delivering clinically effective dosages in compounds that are essentially lab synthesized and have actually been used in studies, the ability to do that is approaching zero. Right. So most of the supplements on the market, while they may have a performance benefit and they may have a role to play as part of a lifestyle for getting peak performance or something like that, as a normative inclusion in a nutritional program, is tough to see where those fit. It doesn't mean that somebody won't figure that out. It's right now, it's tough to have a high degree of confidence that, oh yeah, this is something that a person should be taking every day, right, simply because the data hasn't quite been supportive of that so far.
Right. And so if I have a dog who's in an early stage 1 cancer, they've been diagnosed, and I've fed kibble all my life, and I'm looking to try something new, and they walk into a store like mine, of which there thankfully are more and more every year, because we don't sell kibble, and so they walk into a store like mine and they're trying to do this kind of thing. What simple advice would you offer? The first advice I offer is don't panic and do work with your cancer doctor, your oncologist. But the diet is their responsibility. The cancer treatment is the oncologist's responsibility. What advice would you offer to those people?
Well, I mean, frankly, I think you've nailed it. And I think where a lot of people struggle, I see this a lot, is, and maybe you've experienced this yourself. My dog has cancer. Oh my God, this is a setback. This is bad. Now, how do you know that? Well, my vet told me. Okay, well, how does the vet know that? I don't know. Well, did they do a biopsy? No. Is there some indication in a blood panel that may indicate? I don't know. Well, how did they know? That's what they said. So oftentimes the pet parent has received a diagnosis but doesn't truly understand from whence that came. Right? Now, sometimes they have a little bit more information. They say, yep, they did a pathology and it says it's spindle cell carcinoma. Okay, well, that's specific. Do you have the pathology report? Can we look at what the stage and grade of cancer is, what the mitotic index is, what the margins and cell differentiation? Oh, no, I don't have that. Okay. What was recommended? Well, we're supposed to do chemo and radiation. Okay, presumably, right? What is the delta on a Kaplan-Meier curve between survivorship with no treatment and survivorship with treatment? Well, I don't know.
Yeah, that's that informed.
Okay,
right?
Right. So, yeah. So oftentimes what I find is that there's such a paucity of information. And when I say information, I just mean facts about the disease itself, specific facts, and the correspondence between those facts and any given decision that a pet parent may want to make on behalf of their dog. One of the things that oftentimes is greatly lacking is whole body CT imaging of the dog, because it may be the case that a surgery is recommended, and so my dog's old, I don't want to give I don't want the dog to have surgery. That could be, in fact, the correct decision, particularly if there's been metastasis and the tumor load is large. But if you had whole body imaging and it showed that this was an isolated tumor, at least at that time, and no metastasis, and that the prospect of a surgery achieving clean margins is high because you can tell that by imaging, then all of a sudden now the decision may be very different when it comes to making a choice about surgery. So for me, it's oftentimes before anything else happens, let's collect facts. Now, there are challenges to this, not the least of which is economic, right? CT imaging is expensive. It can be a couple $1,000s just to acquire an image. Doing more comprehensive histopathologies is expensive. Doing blood panels that tell you more is expensive. So oftentimes there's an economic barrier to doing these things, but presuming that that's not there, presuming that people are willing to incur those expenses, and oftentimes they just don't know that those are options. It's really tough to make a recommendation. I mean, obviously, reflexively, improving an animal's diet in any way, shape, or form is a step forward. So it never hurts to make changes to nutrition which move the animal forward. That it will necessarily correspond to addressing disease is very difficult to know without having facts about the disease which tell you something. For example, if you have a whole body CT scan and you see that there's been tremendous metastatic progression from the spleen to all over the body, well, that's a stage 3, stage 4 cancer. You have to prepare yourself to understand what that means, which is the likelihood of survival is very low. Now, if you have those facts at your disposal, that may inform you about whether or not you even want to make dietary changes for the dog, particularly if that dog is effectively going into hospice at that time. So these are the root considerations. But I think you have it right that working with the oncologist, working with the veterinary professional constitutes an important first step. And anything that you do to make improvements in other domains is completely within the control of the pet parent, for sure.
And certainly I find, and when I talked to Dr. Ian Billinghurst, he wrote a book recently called Pointing the Cancer, and he's strictly saying dietary disease, and not strictly. I mean, there's some cancers that he's very clear that they just they're created through genetic bad breeding over generations and so on. But that primarily cancer is a dietary disease, and that we have a medical system that doesn't care about diet and a diet system that doesn't care about medicine. And so that's why I say the diet is your responsibility, the cancer is the doctor's.
Yeah. Well, and I think it also, you're sort of developing a conversation, which I think is important at a meta level, which is, look, the relationship between patient and medical professional is, and must be, frankly, pursuant to success, hopefully, collaborative, right? It must be collaborative. There must be a back and forth, and there must be a consensus to work together, and most importantly, to troubleshoot. I mean, medical professionals know this, particularly oncologists, whether it's a small animal veterinary oncologist or an oncologist that works with human patients. They know the limits of the medicine that they can deliver. They're acutely aware of it. They face it every day. And so hopefully the relationship between patient and doctor can be one of exploration, of discovery, of troubleshooting, and of exploratory thought, all on behalf of the patient. Particularly if it's a dog, the dog doesn't have much say. It's the humans who are advocating on that dog's behalf that have the say.
Now, we've been talking a lot about diet. We've been talking a lot about ketogenics. We've been talking a lot about cancer. What are some of the simple benefits you've seen from dogs going on to an anti-inflammatory diet?
Well, I mean, the thing that always just impresses me, or I should say makes an impression on me, is the change in body composition. I mean, this is something that's visible. You could just see it. And I see this all the time when where I live in Los Angeles, there's a dog park on every corner. I take my dogs to the dog park, and you could just see the physical differences between my dogs and most dogs. Most dogs are obese. My dogs look like bodybuilders. They're ripped all the time.
Yeah.
So anyone, and this is the feedback that, people, humans love to do, Transformation Tuesday, say, oh, this is what I looked like at the start of the year, but now I've made improvements to my physique, and look at me now, you can see that there's improvement. I see now people starting to do this with their dog. Here's my dog. This is a little bit of a chunky monkey dog, but now look, I've made some alterations to nutrition. Look how lean and trim the dog is. So dogs in the wild, if you look at them, they look like Olympic athletes. They're lean, they're muscular. You can see the separation in the muscles. You can see the striations in the muscles when they run. You can also see that if you take a dog's skin and you pinch it and it's squishy, that's not necessarily fat. Oftentimes that's water, right? That water is there because of a preponderance of carbohydrate.
Right.
And so just the physical changes in the dogs, the brightness in the eyes, the energy levels, I think those are the things that people respond to most favorably. And the thing is, these dogs' metabolisms are so phenomenal. You don't have to wait 3 months. You just have to wait 3 weeks, and you see it. So I think that has the most profound impact. The other thing that people, and I get calls about this, like, hey, did I mess up my dog? What do you mean, did I mess up? Well, they're not pooping as much. Did I hurt them? No. The volume of stool by definition decreases once you pull out those high glycemic carbohydrates. And a lot of times the reason also dogs have a high volume of stool is because there's cellulose in a lot of dog foods is put in as a filler. Yeah, exactly. So those changes are to be expected, even though for sometimes people they're shocked by it. Like it went from this huge thing to just these little pellets. But yeah, that's about right.
You brought it up. I mean, they're facultative carnivores. And then when we feed them a carbohydrate-rich diet, and they have very little amylase and almost no cellulase that their pancreas makes. And so they can't really actually digest things. They're getting the nutrition from what was sprayed on, from the vitamin pack that was imported from Asia. I mean,
right. Yeah. Well, that's a challenge. In fact, you're speaking to something that's worth considering, particularly when it comes to micronutrient, because that's a big part of sort of the landscape of discussion. And the actual payload of micronutrient in any given commercial kibble varies wildly, because it really depends on when in the manufacturing process it's introduced. And the reason why that's important is because you may introduce the requisite amount of micronutrients. And, there's another debate whether it's synthetic or not, but presuming that the right amounts of each thing are there, if there's a subsequent heat process, the net result is that they're not there.
Yeah.
And so that's a challenge. And sometimes there's challenges just in the other direction, which is there's too much of something. And oftentimes that comes as a result of a co-packer not having a mixing protocol down correct and things like that. So micronutrient is definitely a challenge when it comes to commercial foods. And the great news is if you look at dogs in the wild, this is an important thing to consider. Zero dog eats a balanced nutritional program.
Correct.
Zero. They go through periods of deficit. They go through periods of abundance. And there's definitely an interval of having sufficient micronutrient balance. But the great news is that they're built to endure that. Now, that said, that's not an endorsement that domestic dogs should somehow have to endure that. But the point being that if a dog is eating a fresh food diet, even if the micronutrient balance isn't perfect, that's not going to move them backwards dramatically unless that deficiency is sustained over a long period of time. Then yeah, you can run into trouble. And the great news is these are easily correctable things just with micronutrient supplementation.
Well, yeah, micros and variety, and just changing things up on a regular basis.
Precisely. Yeah.
Exactly. So that's awesome. So now I just want to touch on some of your work with some of the nonprofits you've been working with, because I got to say, you're pretty awesome, dude. Like, you're doing some great work.
My self-esteem is rising. This is
a mutual admiration club. It's all good. But you've done some really good stuff, Daniel. And so Keto Pet Sanctuary, I don't think you're with that organization anymore, but you were with them as one of the founders. It's an exceptional organization, offering great info. And are they involved in the studies around cancer in dogs and diet? Or are they just offering people?
Yeah, the focus for Keto Pet now mainly revolves around education for pet parents, and they continue down that road. Much of that is really collating and bringing to the fore the great work that other people are doing. My focus has been primarily now on Pause for Change Foundation,
I was headed
which
there.
really takes Yeah, which really takes Keto Pet was mainly focused on cancer, but Pause for Change is really about some of these broader issues like intact spay neuter.
Yeah.
Look at that's very important. Dr. Karen Becker, I think, has done a phenomenal job of at least bringing consciousness to this idea that, hey, look, the data, the science is now showing us that, removing hormone production actually does not incur a benefit over time because it stresses the adrenals. It has all kinds of effects that actually downregulate an animal's capacity to perform adequate immune function. And so she's been just a fantastic advocate for surgical techniques that essentially allow a spayed or neutered animal to remain intact, just preventing the ability for that animal to procreate. That's really, really important. That's a big issue that we care a lot about. The other thing that we've done over the last year is a project called Know Your Pet Food, and you can see the results of that at knowyourpetfood.org, where we actually take commercial food products, pet food products, and subject them to very, very rigorous third-party lab testing. And what comes out of that is just absolutely fascinating. For example, we looked at a popular vegan dog food and we did genetic testing on it and found that I think that there was like horse and rabbit or something in it. Now, obviously in very, in inconsequential quantities, but what does that reveal? It reveals that in all likelihood, that kibble was produced on a line that also produced meat-based products. And, whether or not you think feeding vegan pet food is a good idea, and there's a conversation to be had there for sure, anyone who's buying that product would likely take a second look at it if they were to understand, like, oh, wait, this actually has trace amounts of meat in it. That wasn't why I was buying this. Yeah. So there are interesting discoveries like that. And, to get back to your point on micronutrient, that's where we really started to see that the net payload of micronutrient was just all over the place. In many instances, micronutrients were completely absent or in such proliferation that one might be concerned about giving the dog too much. And these are only the type of things that one can discover by doing these very, very precise third-party lab tests. And looking at this, because these aren't the things that, the dog food companies do these tests themselves. They just don't publish the results. So we're just sharing the results publicly.
Yeah, they're considered proprietary. And so is that's knowyourpetfood.org?
Yeah.
Pauseforchange.global, is that correct?
Yeah, that's accurate, yeah.
Awesome, okay, and just trying to get it right. And then are you still involved in Epigenics?
Tangentially, yes. Ron and I still maintain a correspondence around that. And, he's continued, him and his team of scientists have continued to pursue any number of initiatives surrounding early cancer detection. One of the sort of the big victories that has developed in the last couple of years is the small cohort study we did a couple of years back with brain cancer patients at Cedars-Sinai, has now developed into a study at Cedars run by Dr. Hu and Dr. Black that they're controlling and looking at using a ketogenic diet as an adjuvant therapy for your traditional Temodar and dexamethasone treatments for brain cancer patients. So Epigenics continues to exert its influence in that domain for both people and dogs.
That's awesome. That's awesome. And so I guess what's the final piece of advice? We'll wrap this up. I know you have another appointment coming up here. What's the final piece of advice or the final word you would like to say to anybody who's interested in this? How would you, where would you point them? How would you help them understand what to do next?
Sure. This may sound a little nebulous, but being curious is probably the attribute that leads to the most interesting discoveries, and also encourages people to take ownership of the outcomes. One of the things that's so interesting and also so challenging about working with dogs is while they're phenomenal communicators, sometimes we as humans aren't the best recipients of that communication. So truly understanding what a dog's experiencing, what they're going through, and how they respond to whatever it is you do on their behalf is not the easiest thing. And so what I find is that for me, really staying in that place where I'm curious, I'm constantly in a place of discovery, puts me in a position where I'm constantly learning, which is very satisfying. But oftentimes it puts me in a position to do better work on behalf of my canine companion. And obviously, for people who are local to your area, being able to go in your store and literally just hang out and talk will probably do more for their dog than any other thing that they do. Because the conversation that transpires in your ecosystem is going to be one that opens people up to considerations that, just aren't part of the popular consciousness. They're becoming mainstream, but they're not quite mainstream, right? It's not mainstream that it's reflexively self-evident that a fresh food diet is appropriate for canines and felines. That hasn't happened yet. We're close. But, the more people can hang out in places like yours, I think the more broad-based that conversation will become.
And then the other thing I would add is people check out the Dog Cancer series by Rodney Habib, and it's exceptional. Yep. More well highlighted in that series. We loved it, and to be honest, there's so much there. Like, it's so voluminous. I haven't seen it all.
Yeah.
I don't know that I ever can see it all, but if you want to dive in deep on dog cancer, that's an exceptional resource.
Indeed, it is a weighty tome of information. I think it's a 6 DVD set. One of the things and hopefully we'll get to it this year is to do a feature edit of that. That's 80 or 90 minutes, so people can get the gist of it. But that definitely constitutes an exceptional resource because it collates all the top minds, both in human medicine and small animal veterinary medicine. And focuses the conversation on the intersection of metabolism and disease as pertains to cancer. So
beautiful, man. So thank you very much. I think we'll wrap it up there. Danielle, can't say thank you enough. This has been very kind of you to give us your time today.
No, I appreciate being able to connect, and let's do this again soon.
And I'm just going to stop recording there. So Daniel,